Abortion. It's not just my body. When have we started excusing bad behavior and bad choices when a fetus is involved? I'm here to persuade you that unless a pregnant woman is pregnant by rape, incest, or is dealing with health issues that is fatal to her or the fetus's health, abortion should not be allowed. My training in the crisis intervention program has taught me that as humans, we deal with trauma in different ways. Like my sister, who found out when she was 4 months old that she was having a baby girl, yet something was wrong with the baby. She was told to go see a specialist in Houston. When she arrived, they diagnosed the baby with anencephaly. A heartbreaking news that no woman should face. She drove home crying and screaming, why? At 6 months, she had to make the decision to go ahead and get the procedure. She went in to the hospital, signed the paperwork, was hooked up to a machine while wearing a gown, and administered Pitocin. Pitocin is the drug that pushes labor into effect. Once the baby was born by a spontaneous abortion, she cried out. The baby did not last after a few moments and was announced dead. She didn't understand why it happened. I understand that unless a pregnant woman is pregnant by rape, incest, or is dealing with medical issues, abortion should not be excusable. No fetus wanted to be punished due to a woman's bad decisions. But I'm not here to scold women on bad choices. I'm simply here to persuade you that unless, again, I emphasize, you were raped, dealing with incest, or having medical issues that means your life or the fetus's, abortion should not be tolerated. But let's take a look at the physical, psychological, and the history and the government involvement of an abortion. But first, let's break down what it means. Abortion, according to dictionary.com, is the deliberate termination of a human pregnancy usually involved within the first 28 weeks of pregnancy. A fetus is an offspring of a human or other mammal in the stages of prenatal development that follow the embryo stage. And a heartbeat is the pulsation of a heart. In this slide, you see an ultrasound of a fetus inside of a pregnant woman. Let's take a look at the physical effect of an abortion. So there's two types of procedures. There's the surgical procedure and the medication procedure. The surgical procedure, they call a DNC. This is where they take a sponge-like material and they open up the cervix. The doctor then goes in with clamps and starts ripping away the baby limb by limb. Once there's no baby left, they make sure there's no placenta in there either. The medication procedure is where the woman takes a pill and her stomach starts to cramp. Then another pill is inserted into her vagina, and that is when the baby is born and comes out along with the placenta. There is complications that come with both procedures. One being there's bleeding up to 21 days for both things with small blood clots. You have pain and stomach cramping. The pregnancy symptoms usually disappear within 72 hours. The medicine side effects usually involve nausea, diarrhea, discomfort in the stomach. But the more serious complications that most women should be worried about are possible infections, the incomplete abortion, cervical injury, uterine perforation, heavy bleeding leading to hemorrhaging, retained blood clots in uterus, allergic reactions, and anesthesia-related complications. Now that we've talked about the physical effects of abortion, let's look at the psychological effects of abortion, the ones that nobody ever talks about. Women who have an abortion usually deal with depression, grief, anxiety, nightmares, smoking, alcoholism, drug abuse, lowered self-esteem, regret. They wonder if they're going to be able to get pregnant in the future. They have abnormal eating disorders, and most are involved in suicide, or at least attempted suicide. According to Charlotte Lozier Institute, a 2016 analysis of data along with that says that there's 23% more women who are at the risk of mental disorders who have abortions. 2011 data shows that women with abortions are 3 times more likely to use drugs and 2 times more likely to use alcohol. Women with abortions, 37% are likely to suffer from depression, and 34% suffer with anxiety. And the women with abortions are 2 to 6 times more a risk of suicide. Planned Parenthood had released an annual report of the 2022-2023 of the funds that they had spent that year. They had spent $4,633,499 on STI testing and treatment, $2,250,913 on contraceptive services, $1,065,041 of other reproductive health services, $464,021 of cancer screening prevention, $392,715 of abortion services, and $325,789 of other services. However, prenatal services have decreased by 72% within a decade. Contraceptive services decreased by 41% over time as well. The way we could lower abortions, if not stop them, is by educating our women on contraceptives. Abstinence is not always going to work with younger women. However, if we educate them and let them experience what a heartbeat sounds like, maybe that will change their mind. Now that I've talked about the psychological effect of abortion, let's go to the history behind it and how our government is involved. In 1970, a woman named Norma McCorvey, a resident of Texas, wanted to have an abortion. She was denied and filed a lawsuit against the district attorney of Dallas County, Henry Wade. The Supreme Court ruled in her favor, and that when she filed the lawsuit under Jane Roe, she said that when a mother's life is in danger, it shouldn't just be that acceptable for an abortion, but women should have the right and the privacy to have the abortion, no matter what the cause is. In May 2021, a law was passed by Texas Governor Greg Abbott that covers life or death health risks, but it doesn't excuse rape or incest. In September 2021, the Texas Heartbeat Act became in effect. It prohibits abortions once a fetal heartbeat is determined. Those are usually found within the first 6 to 8 weeks of pregnancy. In 2022, Supreme Court overturned Roe v. Wade in the case of Dobbs v. Jackson's Women's Health Organization, stating that the right to an abortion was not deeply rooted in the nation's history or tradition. Since this overturn, 14 states have banned abortion and 11 have created limitations for abortion. 73% of women, due to financial reasons, feel like they can't afford the baby, so they abort. 74% due to education or work, fearing that it'll interfere with their work or school. 48% fear single motherhood and don't want to be a single mother. 12% fear other health-related reasons, concerns to fetus or for own health. 0.4% due to rape or incest. 0.3% due to risk to the woman's life or major bodily function. And 2.2% due to other physical health concerns. As of 2022, the statistics of banned abortion states versus non-banned abortion states are at an all-time low. You have Alabama with 3.8%, Arkansas at 2.8%, Idaho at 2.7%, Indiana at 7.1%, Kentucky 3%, Louisiana 5%, Mississippi 3.9%, Missouri 0.1%, Oklahoma 2.7%, South Dakota 0.8%, Tennessee 4.6%, Texas is 2.8%, West Virginia 2.7%, and Wyoming is 1.8%. The top 5 states that have the highest number are non-banned states, like New Mexico at a 28.8%, Illinois at a 22.8%, Washington, D.C., 22.4%, Kansas is 21.6%, and Florida, 20.5%. Abortion. It is not just my body. I ask you, have you ever heard a fetus heartbeat? Have you ever seen a video of a fetus being ripped out of the body because of an abortion procedure? I challenge you to look up the videos. It will break your heart. In this video, I'm not asking you to agree with me. Nobody should tell a woman what to do with her body. I do disagree with the reasons behind it. If you have not been raped, a victim of incest, or dealing with medical issues that are life and death, abortion should not be allowed. No fetus should be punished due to bad choices or bad behavior. They didn't ask for it, and it's heartbreaking to hear and see. Just remember, abortion is not just your body.